Hello, everybody, and welcome back. Today, we're going to be talking about feet care for people over 60. This is a really important subject because without your feet, you ain't walking, or it's going to be very painful to walk. So, I know, especially for a lot of men, they don't tend to pay attention to their feet and the problems that they might be having. So we're just going to go over a few things of preventing why it is so very important to make sure that your feet are in good standing with you because you need them. You need them to walk. So as we age, your feet can become more susceptible to problems. Arthritis, neuropathy, and poor circulation are just a few things. But these things can lead to pain and discomfort, difficulty walking, which can, like we said, impact your mobility and your independence. So if you want to stay independent, you got to make sure that your feet are healthy. Um, so the proper foot care, including regular inspections of your feet, appropriate footwear, it helps to prevent some of these problems and to help keep you active. Especially like some of the things like your poor circulation. Like I have a problem right now with nerve. I've had things dropped on my feet recently, and I have a problem like where it hit, where it's like the nerves, it's numb. Okay, so it's numb around my big toe area, but I notice if I keep massaging that area, that'll start getting the feeling back. So having a foot massage, even if you buy one of those, I don't know about those devices, but we all know about those devices that do the feet massage. That can be a great thing, if it's helping to massage the bottom of your foot, and they do believe that the bottom of your feet also have those pressure points and stuff that they do use in Chinese medicine. But I don't know how great they are as far as, for me, it would help a little bit on the bottom, but it's mostly the top of the foot. So doing, I know guys, you're not going to like this, but pedicures, because they do massage your whole foot. If you've ever had a foot massage, number one, you're going to know how great that feels. I personally have done massages. I did get trained as a masseuse, two different types years ago. But it's something, you ride a bike, you never forget, that type of thing. So it's very important that, it, just do one. I know, guys, this is a thing that you're like, I'm not getting a pedicure done. You don't have to get your anything put on your nails, your toenails, but this is just something to, because they'll do the foot massage part, and also soaking your foot, doing the massage, and helping your toenails. Guys, come on now. It is so bad seeing a man with those thick toenails are like this thick, and they're overgrown your toes. Guys, you got to get that fixed. Some instances, like, when I was helping people who lived in a senior facility, we had to get a podiatrist in there for his special tools to cut those toenails because they were so thick. So this is a thing, like whether there is something that they can give you to help thin that growth of the toenails, I don't know. You'd have to check with your podiatrist, but that is something that can be done. You can trim those toenails. Okay, you can get your whole foot massage, which can help with the circulation, can help with nerves not feeling things in your feet. And if you're diabetic, that's the number one issue, is because of the fact that you lose the feeling in your feet and you don't know when there's a cut in your foot, which, can lead to terrible, terrible things that we all know. Sure, your doctors told you if you're diabetic. And so this is just some of the preventive things that you can do. There is also several foot care products out there to help the dryness. I'm sure some of you have noticed that your feet looked around the edges where they had that white look, and they look very crusty. I don't know how else to put it, but there is there are creams out there that do help with that. I have used some myself, and they did work for me. Now, see, they're gonna work for you guys because everybody's body is different. But just remember that we do need to be taking care of our feet and do the preventive stuff for your feet. You can't also just, do the soak yourself, and maybe while you're sitting there watching TV. It is hard. As a masseuse myself, it is very hard massaging your own foot. And then you're like, God, I wish somebody else would just do this. So, just, we just bounce to do it. I don't know. Would I do it with my husband? Probably not. Because I'd say, no, let's go pay somebody who does this for a living and let them do it, okay? So, according to the American Medical Association, foot problems are a significant risk factor for falls in older adults. Painful feet, the balance issues stemming from foot problems, and inappropriate footwear, they all contribute to an increased risk of falling. And the falls, of course, we know can lead to serious injuries like fractures, broken bones. They can significantly impact your life. So the regular foot care can help to improve your stability and reduce the chance of the risk of a falling. For early detection of health issues, your feet can often provide early warning signs of underlying health conditions. A change in the skin color, temperature, or sensation can indicate problems like diabetes, which we already talked about, peripheral artery diseases, or nerve damage, which is what I think I have in one of my foot. So the regular inspections and professional foot care can help to detect these issues early, allowing for timely treatment and preventing complications. Because complications, you don't want to have be an amputee. You do not want that to happen. So these are other things that you need to be looking at. And I do apologize. I know there is a glare on my glasses here. That is coming, actually, the light is off, so it's actually coming from, I guess maybe my window? No, not the window. So it's actually coming from my computer screen, so I do apologize for that. So when you're managing chronic conditions like the diabetes or arthritis, the American Medical Association also emphasizes the importance of specialized foot care. People with diabetes, we already know, are at a increased risk of foot ulcers and infections due to poor circulation and nerve damage. So your proper foot care, again, and regular checkups with podiatrists is very important for managing your conditions and preventing complications. You don't want to not be able to walk again, or become an amputee because you neglected your feet. I know I'm harping on this. It is so important. I don't want to see or hear or know of anybody that I know who I have been, telling this, talking to about foot care and how important it is for any of them to have any kinds of complications due to the fact that they weren't checking their feet. They weren't taking care of their feet. So you have to picture this. Do you love playing golf? Do you love playing with the grandkids? Do you love taking walks with your spouse? Do you love working in the garden? Do you love going to sports games? Do you love going hunting? All these things require the use, okay, they don't require, I'll take that back. It makes it so much easier when you have the use of both your feet. Pain-free, okay, that's another thing, pain-free. We don't want to have pain when we're walking. We don't want to be able to only walk a short distance because of the pain, and we have to take a rest because the pain is too much. I mean, don't you want to take if you have grandkids, don't you want to take them on vacation? Don't you want to take them to Walt Disney World or Disneyland or any place, Universal Studios or wherever, camping even, um, you don't want to have that pain of walking because you've neglected your feet, and now you have all these more complications and more problems. It hurts when you walk. You just have all this stuff going on. Please, um, some basic things, like I said, some basic things you can do is, once you go to your initial, um, um, going to have a, not podiatrist, but going to have a, your, oh my gosh, ladies, help me. It just like went out of my head. I'm so sorry. When you go to have your feet done at a salon, um, ladies, we know we get that done. We know we get our nails done and we get our feet done. So guys, once you get over the first time, and what I would suggest that maybe you have the lady do is before she soaks your feet, because your nails may be extra thick, to try to file some of that down first. If your nails are super thick, you need to see a podiatrist first, and then you can schedule um, to go to have a pedicure. Go to have a pedicure time. Once you do your first pedicure, you can do it like once every 2 months, okay? But put that foot cream on, because when you're massaging that foot cream in, number one, it does feel good. And then number two, you can keep those white cracks from appearing on your feet, and it makes your sole of your foot and the outside edges of your foot be very soft, and get rid of all that stuff. But we want to make sure that your daily activities that you do and your social things that you do, that you don't have to be impaired because of the fact that you've got foot pain when you walk. So just do it. I mean, it doesn't hurt. I take that back, because it might hurt. When you're at the podiatrist's office, if he has to use his special equipment to cut the toenails that are super thick, and ladies, we know you know exactly what I'm talking about. You've seen it in your husband's feet, even though guys don't seem to really care. A lot of them, I shouldn't say everybody, but a lot of them don't seem to care. But get them to the podiatrist and get that taken care of first. And then when you go to have your feet done, you just, like I said, about once every other month, and just have her use the steel nail file first to help to, because she probably won't have the special equipment to cut the nails because they're so thick, but she can file it after the initial size is reduced from the podiatrist. So there we are with the foot care. Why it's so important for people over 60 to make sure that their feet are nice and healthy. And if you guys would like, I'm trying to retire here. Share, like, subscribe. Since I am still having to work, I just turned 65, but I'm still having to work now. And I work from 2 p.m. to 11 p.m. at night. So I basically only post my videos on my 2 days off, because I want you guys to be able to see my videos during the day, get notification that I just posted something. So helping me get to where I can retire, to get monetized so I can retire, would be greatly appreciated. And I hope that you do like the content that I am putting out so far. It's being fun. It's something that I like because I'm going through it. So thank you all for being here. Thank you for watching. And until the next video, everybody take care. Bye-bye.